So I think there are several advantages to using MAKOplasty as a surgical technique to help patients. First and foremost, the image-based navigation component gives you a lot of information before surgery to help understand your patient's anatomy. And so it's important to understand that this is a tool that we use, and the surgeon still has to be the surgeon. The surgeon still has to do the operation. The beauty of this is that we get so much information ahead of time that we're able to really pre-surgically plan a partial knee replacement and a total hip replacement within much smaller parameters, much more accuracy than we formerly were capable of doing. We're talking about planning things down to a millimeter or planning things down to a degree, as opposed to 2 degrees, 3 degrees, which the naked eye is capable of visualizing. This is the workstation, and we've gone through the preoperative planning. Intraoperatively, there's a tremendous amount of flexibility to this. So in the partial knee replacement world, for example, we're able to modify the plan to achieve ligament balancing intraoperatively. And that's really what it's all about in terms of getting the best outcome for a patient. With respect to hip replacement, we can get leg lengths and offsets very accurately intraoperatively, and we can make adjustments so that we're putting a patient's hip back where it belongs. The theoretical benefit of these things is if you reproduce the patient's anatomy in a way that's more accurate, we would anticipate that the outcomes should be better. Safety-wise, this is an incredible tool in that what you plan is what you get. When we're doing hip replacement and knee replacement with conventional instruments, it's kind of like pinning a miter box, which is a small cutting jig, onto the knee pieces or onto the hip pieces, and then reaming away or cutting away the bone. And those cutting instruments have a certain domain in which they work, which has to be controlled by the surgeon. With robotic surgery, you can only cut within the areas that you have planned. So when we look at those partial knee and total hip replacement plans, you'll see the green haptic volume, which is the volume of the implant that you're planning for. And those surgical tools on the robotic side will not work outside of that haptic space or that room that you've selected to ream away bone. And I think that's very important because there are vital structures that surround the bony pieces that you're working on, and with robotic instrumentation, you can't push the robot to get in those soft tissue structures because it just won't work outside of that green volume. The outcome, I think, is obvious. If you're cutting only things that you plan to cut, you're minimizing surgical trauma. If you're able to really accurately measure the bone that you're removing for a partial knee or a total hip replacement, or soon to come a total knee replacement, the obvious is that you should be able to get better outcomes for your patient utilizing these tools.